The Secretary to the State Government, Professor Kenneth Kano, you're highly welcome, dear SSG. Let me also welcome the Chief of Staff to His Excellency the Governor, Pastor Caleb Ajaba, PhD, you're welcome. Ladies and gentlemen, we have here also the Deputy Chief of Staff, Barrister Chijioke Wankwo. You're welcome, sir. I'd like to welcome also honorable commissioners who are here today, with particular mention of the Honorable Commissioner for Health, Professor Uche Obonia. You're welcome. I'd like to also welcome special advisors and senior special assistants to His Excellency the Governor. I'd like to also appreciate the heads of different government establishments who are here seated. Permit me to use the General Manager Asopadek, the Venerable Onyike Joshua. You're welcome. We have also various local government areas through the primary healthcare centers. And today, Abia na imezu ya bụ nkwa onye na-achị Abia steeti kwere anyị anya na-ekele ya na onyinye ọma ọ bịara inye ndị Abia steeti, and starting off with the Benda local government area. We appreciate you, sir. Because before we move to the next item, which we'll be doing it the traditional way, it's also important that I make mention and welcome the man at the helm of affairs of the Primary Healthcare Development Agency, Dr. Carlo Olokano. You're highly welcome, Executive Secretary. Having said that, Ogedim Bakandi Baranankeha, Bupotochi, Kewarena Bata, Operem Kwame Abia State, Governor Horo Omabia. Nandi na buge ndi Abia na Abia State there enweta ihe ha ji na-enye ndụ ha aka ka anyị were ọjị nabata ya gbaya na ndị ngwu osu akọli mere appreciate ihe ọma o webetere ha dịka presentation of area.
The Deputy Chief of Staff to the Office of the Deputy Governor, my dear brother, the Liaison Officer to the National Assembly, Chief Frank, I meet you. OEC, ndị ozu akọli wefutara ọjị, a na-agwa ya na ọjị a dị mma. Ọ dị m ka biko ndị ozu akọli niile na ebe a na ndị bende ndị ọzọ biko ka mụ na unu pụrụ ọjị a ka m gawa n'ihu. The Executive Chairman of Benda Local Government, biko ọjị abịala. So, Benda, Mamano, Riano, Mono. Your Excellency, sir, and they encourage background of Benda. Because permitting.
That's the Uchendo Gode. Chairman, Abia North Traditional Leaders Council. In your knowledge, India's a leader no go because Otti Bunkia at an Akali. The Chairman Emeritus. Otti I can make us Ojioma. Can have a pompo. Chineke onye kerele igwe ka ọwa anyị na-enwe ekele nga ọ dị ukwuu leduru nna anyị ukwu Ekwueme Abia dute nga a n'udo. Anyị na-ekele gị n'iduru ndị niile bịara nga a n'udo mgbe ha ga-elakwa n'udo. Ọjị ndị ụzọ akọli wetara, Chineke onye kere eluigwe kee ụwa kee mkpụrụ osisi ka ọ bụrụ ihe anyị ga na-eri na-adị ndụ. Anyị na-arịọ ka egozie ọjị ọnwa, bụrụ ọbara nwa gị Jizọs sachaa ya. Anyị niile ga-eta ya, ọ ga-erụọ ya afọ. Onye ọbụla ga-ede ndụmọdụ ọjọọ, udo ga-iso anyị n'aha nke Nna na nke Ọkpara na nke Mmụọ Nsọ.
Health loving, health promoting, amiable governor of Abia State. The secretary to the state government, Professor Kenneth Carlo, the chief of staff to the governor of Abia State, Pastor Caleb Ajaba, PhD. All honorable commissioners here present. The SA Health, let me use the SA Health, Dr. Ngozi Azodo, to reach out to all the special advisors and senior special assistants to His Excellency. Distinguished members of the Abia State Executive Council, the Permanent Secretary, Abia State Ministry of Health, Dr. Ifeniwa Blossom Omakalo. Let me use her to reach out to all permanent secretaries here present, heads of MDAs and units of the Abia State Ministry of Health. The mayor of Bende local government area, Dikin Wabukonye Basi. Let me use him to reach out to all the mayors here present and all those working in the local government areas of Abia State. Former mayors, traditional rulers and royal highnesses. Let me use the traditional ruler of Ungu, Uzuakoli, Eze Bulam Okori. The clergy here present, members of the press, Ndi Uzuakoli, Ndi Bendenile, Ndi Abia, ladies and gentlemen. It is with profound gratitude to God Almighty that I stand before you to deliver this address at the flag of ceremony of one of the impact projects of His Excellency, the health-loving governor of Abia State, Dr. Alex Otti OFR, codenamed Jektekweme, which, when translated, means renovating and retrofitting 200 PHCs in 100 days. Today's flag of ceremony. Thank you. Today's flag of ceremony symbolizes the rebirth of hope for equity in quality healthcare access for Abia after many decades of despair and neglect. Therefore, welcome you with great delight to witness this era-defining event, marking yet another great milestone in the multi-pronged strategy of the administration of His Excellency, Dr. Alex Otti, OFR, the amiable, award-winning, relentless, visionary, trailblazing, courageous leader of our state. A passionate health purveyor to comprehensively rejuvenate the health ecosystem so as to deliver sustainable care to Abia down to the last mile. Your Excellency, please permit me to highlight and acknowledge your visionary leadership and legendary commitment to the health and welfare of Abia. At the inception of your administration, after observing the comatose state of health facilities and service delivery, you declared a state of emergency on the health sector. And with a stout hand, you instituted emergency resuscitative measures to quickly fix key health facilities and provide improved healthcare services. You then unveiled a blueprint for a comprehensive whole ecosystem upgrade of health facilities to standards that present to our people a realization of the long cherished expectation of enjoying the dignity of quality healthcare irrespective of socio-economic status. Your Excellency, you match your words with action by allocating 15% of the 2024 budget to the health sector in compliance to the Abuja Declaration of 2021, setting off a new record in public health care financing in our country. You have also repeated the same feat in the 2025 appropriation law that was recently signed. You're intentional and customized. Therefore, Project 200 PH, it covers sites that are identifiable when you move around Abia State, clearly making our state a healthcare construction site. And the good people of Abia State can clearly attest to the forthrightness of this government in making investments that address priority needs of the populace. According to the World Health Organization Declaration of Alma Ata, primary healthcare is essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at the cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. This is exactly what you have empowered the people of Abia State to achieve. So primary healthcare is therefore the first point of access to affordable healthcare by the populace. Therefore remains a pivot for achieving health for all through universal health coverage, which addresses the core objective of the third sustainable development goal. By rebuilding and functionalizing 200 primary healthcare centers, Your Excellency, you have demonstrated a deep understanding of the significance of bringing healthcare closer to the people in every ward in Abia State. The choice of Ungu PHC in Uzuakoli, Bende, local government, as the flag of site is not only intuitive but informative. Firstly, Bende local government is the largest local government in terms of the number of wards and autonomous communities in this state. It is also one of the local governments with the highest maternal mortality rate in Abia State from the 2024 health indices. When we visited this site in November 2024, we met a woman who delivered on a bare board in this ward. The roofs were leaking. There was no delivery chair, and there were no facilities to render basic health care. That informed His Excellency's choice to come to this center for a flag off. But as he was dealing with the multifarious activities of government, he instructed us to go on and begin the reconstruction. That is why you are seeing a new roof. This is not the original roof that this building was bearing. So the construction has continued for about 34 days. And many of the things you are seeing are a far cry and different from what was there at the beginning. So, with the retrofitting of PHCs, provision of equipment and adequate staffing, the Ministry of Health wishes to reverse this trend, not just in Uzuakoli or Bende, but across Abia State. Ungu PHC is also located in the center of a local community, hence facilitating access and service uptake. Each of the PHCs, likewise, in other parts of Abia State, will have, just like this PHC, in addition, running water, solar power, and accommodation for staff. Your Excellency, I'm proud to report that some of these PHCs are already nearing completion. This is one of the few PHCs that we started work late. So some are in the next few days ready for even commissioning. We are on course to a timely completion of the project by the end of February 2025. In line with your instructions, Your Excellency, the project delivery within 100 days is sacrosanct, as you have instructed. When fully operational, these centers will offer maternal and child health services, immunization, treatment for common illnesses and injuries, and preventive care. all of which are drivers of health outcomes. Project Ekweme is more than just bricks and mortar or roof and wood. It is a promise of a better health, hope for a brighter and healthier future, and a testament to your goodwill, sagacity, and commitment to Abia. Its dividends can only be fully realized when communities actively use and sustain these facilities. So I will enjoin the people of Ungu to ensure that this facility is used by the people of Ungu and Uzuakoli, and that they protect every facility that will be installed in it. So please take ownership of the primary healthcare centers and let us support this government, the policies, the interventions, and protect the investments and ensure functionality for generations to come. Your Excellency, permit me to mention other upcoming impact projects in the health sector. This includes the remodeling of ABSUT and the Abia Specialist Hospital to modern healthcare facilities comparable with their counterparts anywhere in the world. And the Abia Medical City, which at any time from now, His Excellency will flag off. Linking these facilities with the PXCs will create a robust referral system within an integrated health ecosystem. Finally, distinguished guests, the retrofitting of the PXCs under Project Ekweme is a giant leap towards a healthier Abia state, reinforcing the governor's dedication to the health sector. Therefore, urge everyone here, if you are still in doubt, you have to turn around to support this administration, to continue to deliver on these impact projects. And together we can make Abia State a shining example, not just in the healthcare sector, but in other sectors. I wish to recognize the hard work of our team, particularly the SA Health, Dr. Ngozi Azodo, the Permanent Secretary, the Minister of Health, the Project Consultant, the Executive Secretary of the Primary Healthcare Development Agency, all project coordinators in the 3 senatorial zones. I can see them, Dr. Wiburu, Honorable Victoria, Chief Victoria, and Honorable Lukman, who actually spent the whole day yesterday ensuring that this place looks like this. Your Excellency, on behalf of the Minister of Health, I salute your steadfast commitment to the health and well-being of India. This flag off mark the beginning of a healthier and more prosperous Abia State to the glory of God. Thank you. May God bless Dr. Alex Otti, OFR. May God bless Abia State. And may God bless Nigeria.
Please, can we do better with the round of applause?